Hello and welcome to this edition of EC3 HOSA Medical Moments. I'm Gina Ryan, Director of Hardin County Educational and Community Television, and I'm going to be taking my mask off today because, one, it is difficult to talk through, and our guest and I, we are a good 12 feet apart, so we won't be in each other's space. Let's just say it that way. So joining me is Terry Bergen, who is the Public Information Officer for the Lincoln Trail District Health Department. And Terry's going to bring us up to date on the latest numbers. We haven't been together for about a month. During that time, Hardin County Schools has gone back to face-to-face instruction with a hybrid A-B schedule, and also we offer an online academy at the present time. Of course, as we tape this show, things are changing on a daily basis. So this is taped on September 4th, so we have the Labor Day weekend, and on a daily basis things change. So Terry, for our audience at home, what are some of those up-to-date numbers that you can share about the district?
Well, as of 4:30 yesterday afternoon, as a whole, Lincoln Trail District Health Department service area has a total of 1,925 COVID cases. Okay. What I do want to stress here is that these are unique cases. These are not repeat cases or duplicate cases, because a lot of times people have questions about that. These are unique individuals. 958 of those were Hardin, 108 LaRue, 181 in Marion, 151 in Meade, 154 in Meade, 394 in Nelson, and 130 in Washington County.
Now, how many are presently isolating of that number?
So what I mean by duplicate cases is that a lot of times we get phone calls asking if they're repeat positives. Are those numbers included as part of the 1,925 cases of COVID? No. These are one person. Each number counts for one person who's been positive one time. So we've had a total of the 1925 cases of COVID within our district. Now, if we break down that a little bit more, 1,673, so 1,673 of that 1925 have recovered. We still have 221 that are still at home quarantining or isolating, and 10 of them are in the hospital. When we look at deaths, Hardin County has 8 deaths, LaRue 1, Marion 5, Meade 3, Nelson 3, and Washington has 1 death.
Okay. Again, for an area our size, I feel that those are pretty positive numbers.
Well,
it could be worse.
Yeah, it could be. You're right. It could be a lot worse. You're exactly right.
Not that we need to be diligent and keep doing what we're doing, but thankfully it's not as bad as some other cities and larger areas.
Well, and let me say this too, Gina. Our numbers are increasing. Now, we have been steadily increasing, and we're a little concerned about Labor Day. I'm not going to lie to you. When around Memorial holiday, 2 weeks later, because you know it can take 1 to 14 days for COVID to occur, we saw about a 32% increase in cases, right? The 4th of July holiday was 82%.
Oh my goodness. And
so we are bracing for the Labor Day, 2 weeks post Labor Day holiday, to see what we will see, because we're already seeing an uptick in our cases.
Well, and school has started for many of the counties that you all work with and oversee, so that probably is similar too.
Yes,
because of
that will be a contributing factor. Yeah.
Now, are we doing what we need to do in terms of testing? Has testing increased since schools are back in session, and have you noticed an increase? And do you all receive those numbers about the tests that are given?
What we receive are the positive results. Okay. So we do not receive negative results from the labs. One of the things that testing does for us, or allows us to see, is how widespread COVID is in our community. So we know right now, without any further testing, that our counties, all of our counties, tend to go from community spread, which means that individuals have no idea where they picked up COVID in the community, to accelerated spread, which means there is a rapid transmission of COVID within our communities. We go back and forth between those two. So that's one thing that testing does. It also allows us to see if there's anybody who is asymptomatic out there, allowing those to be identified with COVID if they have it, quarantined to prevent further spread in the communities. So doing the testing is great, and it allows us to see those two things. It helps us in those two ways.
Does the summer help with the not the condition, but the symptoms? Are the symptoms still as severe and dire as they were back in what we call our spring season or our winter season?
It varies from person to person. Let me say that. So some people will have no symptoms, mild symptoms, or be severe, have a severe course of COVID-19. It seems to be continuing the same regardless of the season. So people are still experiencing headaches, cough, fever, loss of taste, loss of smell. Some folks have abdominal cramping, diarrhea. We're still getting reports of all the various symptoms that we've heard of all along.
We have been working closely, we being Hardin County Schools have been working closely with your department. What is your role with the various school districts in your area?
We're collaborators. We're partners with the school system. So we provide public health guidance to help protect students and staff and to reduce the spread of COVID within the school system. We look at the KDE, so the Kentucky Department of Education guidance that the schools have received. We look at that also to see what the Kentucky Department of Education has outlined, and then we infuse that with public health guidance to ensure that everyone is as safe as possible.
Okay, that's awesome. What are some of the newer guidelines? Has anything come out recently?
Well, I think the one major thing that has changed is that students and staff are required to wear masks indoors. Before, there was the option to, if you were sitting 6 feet apart, that the mask could come down. But the only caveat to that now is while you're eating. So of course you remove your mask while you're eating, but the whole time you're indoors, students and staff should have their mask on.
Well, and again, I guess one of the mottos, the motto in the schools was if you move, you mask.
Yeah.
And so students are probably always in movement, and teachers are always in movement.
Right.
So it's a good practice.
Yes.
So we do have to get used to wearing these masks.
That's right.
Because it's going to be with us for a little bit longer.
It's going to be with us for a while. Yes.
Do you have any? Do we know of any of the individuals that have gotten better or have healed that are part of any type of research, immunity, or treatment thereof?
What we do when we release individuals from quarantine or isolation, we tell them about the American Red Cross Convalescent Plasma Program, and they can go online at American Red Cross and sign up for that. And they use their blood to potentially treat individuals who are suffering severe consequences of COVID. But as far as whether they do that or not, we're not aware of that. But we do recommend that they sign up for that.
Okay, that's awesome. As you mentioned, with everyone it's different. The symptoms and the condition of the person can be very different from one person to the next.
Yes.
What are some of the long-term health issues of those that survive?
Well, what I want people to remember is that we haven't been in COVID-19 pandemic that long to know the true long-term consequences of what this disease, this virus will cause. That requires research. And we're just not, it just hasn't been long enough. But we do know that COVID can cause some harm to certain organs, which could potentially cause long-term health consequences. But as far as the long-term effects, for sure, we're not sure yet. We just don't know yet. The research has not been done yet.
Okay. Earlier we talked about the testing, Is our positivity rate still in the good zone, even though our numbers have really skyrocketed? Is the positivity rate, which means number of tests that are testing positive, is that still in the good zone, I guess you could say?
Well, the governor's update said, revealed that we had dropped to 4.5 yesterday, and he likes for us to be below 5. So as far as that is concerned, we're doing pretty good. But as I mentioned before, we are still seeing an increase. I don't want people to get comfortable with a positivity rate that's below 5. We still need to do what we need to do, the masking, the physical distancing, the washing hands, to ensure that we continue to reduce the spread, because our cases within the district are increasing.
Right, and at the time that we're taping this, the last 3 days for the state have been some of the highest number of cases.
Yes, and if I'm not mistaken, I don't have the exact number of what he said yesterday, but it was over 900 cases,
right,
which is probably one of the highest numbers we've had to date.
Right.
Yes.
What are some of the things that we're doing well in this area?
Well, I think a lot of people take this seriously, which is good. So, you know, the things that work well, the things that we know that reduce the spread of COVID, the majority of the folks are doing it. The physical distancing, staying away from 6 feet or more, washing their hands frequently, wearing their cloth face mask when out in public really make a difference. And they're the only tools we have right now that work, that we know work. We're hoping for a vaccine, hopefully by the end of the year, but within 2021, for sure, we're hoping that will occur. That will put us in a better position to fight even harder. That'll give us another weapon in our arsenal to fight COVID. But as of right now, if people continue to do what we're doing, as you mentioned before, our numbers compared to other places could be a lot worse. And I think it's because people are doing the physical distancing, the face masking, and washing their hands.
With school back in session for Hardin County specifically, have the ages changed in terms of those positive cases?
Well, we have seen an increase in the number of those 0 to 19. Yeah. So yes, those numbers have increased, which we kind of expect that.
Exactly.
You know, because there is more people concentrated in one area, which could increase the spread of COVID. One of the things I want to say here is that, you know, when you have a situation where children are in school and they're in a classroom and they have to receive instruction in a classroom, and you are in a community that has accelerated or community spread, and if the interaction is longer, so if you have students or at any gathering interacting for an hour or more, or however long that interaction is, the longer the interaction, the more your chances are increased to transmitting COVID. So, you know, being in school in that type of environment, it can lean itself towards that type of increased transmission.
Okay. Of course, we're doing our due diligence in regards to sanitization and making sure that our students are wearing masks. Next week, we do start sports, competitive sports, and we've been given some guidelines from the Kentucky High School Athletic Association, and I think it's important. What do people need to know that are in those, that are going to be outdoors watching football and soccer and some of those outdoor sports, and then we'll talk about the indoor sports next? Well,
if you are outside, it still doesn't negate any other preventive measures that I mentioned earlier.
Right.
The physical distancing, you still need to stand away 6 feet from people that you don't know. I'm not talking about folks in your household. If these individuals live in your house, you know, you're good. But if they are folks that, even with your extended family, that does not live in your house, they need to be 6 feet from you. And then, of course, you should have on your face mask even though you're outside, and continue to wash the hands. The rules still apply, inside or out. Those things should be happening. If it can be avoided at all, if it can be watched on television, it is our recommendation to do that instead of attending a situation where there is a mass gathering, because as I mentioned earlier, it just increases your chances of contracting COVID.
And just, I like that plug, because with that plug, I can say that HCEC-TV will start their live sports broadcasting next week, the week of September. We actually will start Tuesday, September 8th. And the live programming is carried on Brandenburg Channel 1 for those that are cable subscribers, in many of the same counties that the Lincoln Trail District Health Department oversees. But we also broadcast on NFHS, which is the National Federation of High School Sports. So there's opportunities for those at home to watch it, and you can stay safe there. We do want you to support our teams, though.
Yes.
So if you'd like to be a sponsor of any of those sporting teams, you can still do that too. What are some of the other things in regards to immunizations and health services that you all continue to provide to the community that they shouldn't be worried about?
Well, thank you for allowing me to talk about that, because a lot of folks think that we're closed and we're not. You know, we continue to provide services, we're just doing them a little bit differently. One of the services that we continue to operate is WIC. And a lot of folks may not realize this, but we are open. And so if you call the health center in your individual county, you can learn about how to enroll in WIC. We understand a lot of families are struggling right now. Some of them have been unemployed, and the Women, Infants, and Children program could help provide additional food and supplemental food during these difficult times, especially if you have younger children that may need formula. The program also assists with supplementing formula needs. We provide immunizations, is another service that we're continuing to provide. Again, call the local health center for times. And I'm not sure if you've heard of our HANDS program, which stands for Health Access Nurturing Development Services. It is a program for expectant parents. It doesn't matter how many children you have, you can still participate in the program. It's offered in all 6 of our counties. Pregnant women can enroll, and children and their parents' children up to age 2 can be enrolled in the program. And they kind of help you, guide you throughout your pregnancy, answer any questions, refer you to resources, ensure. One of the things that I love about HANDS is they assess developmental milestones to make sure that your children are progressing as they should. They do ages of stages screening to kind of determine that. They also promote safe sleep, and for individuals who do not have a safe sleep environment for their children, if they enroll in the HANDS program, they can receive a pack and play that will provide that safe sleep environment for the children. So we're still operating. We're still doing some good stuff. Yeah.
Have you seen a decrease because of COVID where people may be afraid to come in?
Well, you know what? Our WIC services has increased.
Great, because it's by phone.
Because it's phone. I think because we've made it more convenient, and you know, I think that's the primary thing. It's more convenient for our families to do it over the phone right now. And so it's a simple phone call, and it just makes it easier to participate.
Okay. Well, everybody keeps saying that the flu is just around the corner.
It's here.
So what? Okay, so the flu has already happened.
We've already heard of a couple of cases for this year's flu season.
And what detects flu rather than COVID?
Well, first of all, they're 2 different viruses.
Okay.
You know, COVID-19 and the influenza virus are not the same. The flu virus, we encourage people to get their flu shot. Because
should they start now?
They should start now. There are some places that already offer the flu vaccine. So if your healthcare provider is offering it, we encourage you to go ahead and get it. The flu vaccine will not prevent COVID. As you know, we don't have a COVID vaccine, but it will help prevent you from having a dual infection with COVID and flu. especially since we don't know what the long-term effects of COVID are. During a normal flu season, medical resources are already strained, just with flu. And so if we've got COVID on top of that, it could make a shortage in real critical medical supplies. One way to prevent that is to get a flu shot, not get the flu at all. That will help to conserve those resources for the individuals that really need it, whether it's COVID or not, to have those supplies available. So we are encouraging everybody to get their flu shot this year.
Okay, great. Is there anything that people, I'm assuming to avoid the flu, you do the same thing that you're doing to avoid COVID?
Yes, Gina. The things that we mentioned earlier, the physical distancing, if you're not close to anybody, you know, that reduces your chances of getting the flu. Wearing your face covering and washing your hands often, we believe will help reduce flu as well. Yeah.
So that is a good thing.
Yes.
Any other viruses or illnesses that you're seeing an uptick in that you all also oversee?
Well, we're so focused on COVID right now. We do have an EPI team that is also working on the other things that are coming in. We still get the GI illnesses that happen all the time. We still get the tick-borne illnesses that come in all the time. Even though COVID is going on, those illnesses that we normally see, they're still coming in. And our other the team that handles, our EPI team that handles that are still calling those individuals, just like we do with COVID, and making sure that we get their information and educate them.
Okay. Mm-hmm. It's good to tell our audience that, you know, any information you want, quality information that you want and need, where do they go?
Well, they can always visit our website. We encourage people to go there, ltdhd.org, or they can go to the state website, which is kycovid19.ky.gov. There's a link on our webpage, though, so you can just look there first and then head over there. Are definitely two places to go. And, of course, the Centers for Disease Control.
Okay. Mm-hmm. And the Hardin County School also provides a link for individuals, if you're interested, at the number of cases that have been started since we've gone back to school since August 24th. And it has it broken down by school and also those individuals that are attending in-person school, but also those individuals that haven't even been in the schools. They might be with Online Learning Academy or in another type of service that haven't been in the schools that also have gotten COVID. You know, we've been in this since December. I think, you know, we could probably pretty confidently say that COVID started in the United States probably even before December.
Before we knew what we were dealing with.
Exactly. So is it surprising to you that we are this far along, that we're doing well, or this far along and we need a lot more improvement?
I am not surprised that we are this far along. When you work in it day in and day out, time just seems to go by really fast. I think what is concerning is that we still have a long way to go. And I really want people to know that we had our first case in our area was in March.
Right.
Even though it was
documented.
Yes, documented. That's exactly right. I don't want people to give up on those preventive measures because we're going to be in this for a while. So I want folks to hunker down for the long haul and just be willing to continue to do what they need to do to keep their community safe. I just don't want people to get tired of doing what we need to do. That's my concern. So I want to clarify quarantine and isolation periods because we've been receiving a lot of phone calls about what that time period is and what it signifies. Contact investigation reveals a lot of information that helps us to determine the quarantine period. We talk to individuals often, and so that 14-day for a close contact could be extended if they develop symptoms. The isolation period for a confirmed case can be extended if they develop symptoms. It's not cut and dried. People hear 14 and they think, okay, I'm done at the end of the 14-day period, I'm done. Not necessarily. So we don't want individuals to start determining their own quarantine and isolation periods. And I know it can be frustrating because we tell you're telling us, oh, I've developed symptoms, and we are having to say to you, I'm so sorry, but your quarantine cannot end today because you've developed symptoms. We've had individuals who are in quarantine, day 13, they develop symptoms. And so it's not cut and dry. The other thing I want to clarify is that even if you go to your provider and you get a COVID-19 test and you test negative, it does not negate your quarantine period. You still have to complete it for the 14 or the 10 days. Mm-hmm. Please allow us to determine when your quarantine period ends or your isolation period ends. Your provider cannot really determine that. That falls into the hands of public health. We, and I hate to say it this way, we're the ones who have been assigned that authority to determine that. Not your provider, but the health department.
So you all stay in close contact with those individuals?
Yes, we have to stay in close contact with everyone who's tested positive and their close contacts. So let me tell you this, Gina. 1925 are the positive cases. Each one of those cases have we've had one case have as many as 21 contacts.
Oh my gosh.
Multiply that times 1925. That is thousands of more people, 3,000, 5,000, 6,000 more close contacts that we as the health department, and that's just Lincoln Trail District Health Department, have to follow on a daily basis until they are released from quarantine. And so we are proficient at this, and we have the knowledge to know how to make these decisions appropriately based off of information through a contact investigation that can take as much as an hour and a half or more, depending on the number of contacts that confirmed case has. Yeah. Please allow us to make that determination.
Right. You can't be your own isolation police either.
You cannot. There is no way, because you risk the chance of infecting other people if you cut it too short.
Right. Mm-hmm. Anything else that our audience needs to know about that you want to share? Labor
Day is coming up. We want you to be safe.
Sports are coming up. Please be safe.
Yes. If you're going to have a cookout, please, it's better if it's your immediate family, so the people in your household. If you are inviting people over, please ensure that you follow those rules, those preventive measures. Don't share utensils. Use disposable plates, disposable utensils, so things are not shared. If it's outside, it's even better because the ventilation is outside. If it's inside, it's better if you can open doors and allow the air to breeze through. Just stay safe. We don't want to. In 2 weeks, we don't want our cases to increase.
Okay. So thanks for joining us, and again, just seek out the websites, the information that's there, and you can call. They'll probably get back to you if you leave a question. So I appreciate you joining us on this edition of EC3 HOSA Medical Moments, and have a great late summer, early fall.